Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to have you back with us again today. Many of you have been asking, how do I avail myself of all the previous episodes? Very simple. Go to YouTube. Click on A Time for Truth show. Hit the subscribe button. We'd love to have you as one of our members. All the shows there the last few years are free to you on many different aspects. And tonight we're going to go over something that's really plaguing the world. How to be healthy. How to do something when maybe you don't have the resources. You know, in America, we're very lucky. Many regions, we have very high resources, availability, and we take it for granted. But there are many areas, even in our own country, and in different demographics, this is not the case. And so today we have a very special show that deals with a cutting-edge technology, and we're very lucky to have the founder with us. And Buddha, if you will, if you put up his pictures on the screen, we want to introduce Jack Tawil, founder, chairman, CEO of Medpod, with more than 25 years of experience in healthcare, retail, and finance industries. Jack was the founder, chairman, and CEO of Checkups, which pioneered Walmart's convenient care program and became the largest operator within 23 locations across multiple areas of the country. Mr. Tawil began his career in retail, founding Swatch Express in 1990, and subsequently created Suiza America, working closely with some of the most renowned retailers in the world, including Harrods and Falconable and others. Jack was a partner in SRJ Financial Group, a New York-based broker-dealer investment bank, as well as being a founding board member of the Convenient Care Association and chairman of the board of the U.S. Friends of Lirot, one of the leading funding sources for global vision research. Mr. Tawil is the 2024 Medal of Honor recipient from the Vatican-linked Pontifical Academy of Sciences and a global bell ringer for the Foundation for the World Peace and Love, FOPAL, and a published author on the topic of patient, digital twin, and a doctor digital clone. He has a great sense of humor, great smile, and some people say because I'm a dentist, that's why I brought him on the show. That's not true. But let's give a warm welcome to Mr. Jack Tawil to A Time for Truth show.
Thank you. Pleasure being here.
Welcome.
Thank you.
Yeah. So I know you're very busy, and most of the people watching this, before we get into this tremendous machine behind us, are probably very curious about you and to learn from you. So I wanted to ask you, when you were younger, did you always feel you were going to be at this high level, entrepreneurial, organizational level?
I would say I was always interested in business, but I never imagined that I would be doing what I'm doing today. I actually started in a different industry. I started, my background is actually as a gemologist, and so dealing in the diamond industry, being in the ultra luxury goods industry, and going from that into healthcare is not a natural transition. But it's actually absolutely amazing, the journey, and it really feels like God's work, frankly.
Yeah, it's very interesting because involving in that aspect at a very early age, I would think it immersed you with all different personalities, right? Levels of individualities. How did you feel that impacted you?
Again, I was exposed at a very young age to very interesting people, and I would say movers and shakers of the world. And even some of the things that I did, I worked with the Queen in England, and so I worked with sheikhs, in the Middle East and so on. And so having been exposed to that, I realized that we could really work together and actually change the world. There's nothing that we couldn't do if we actually put our mind to it. And really, I came from a position of innovation. How do you look at the world and see what's missing and what's wrong? And how do you actually go and create something new that's going to change for better for humanity?
Very interesting. I mean, something I've seen since I met you, you're a very humble guy. And you could be on the moon, and I think you'd be relaxed to say, what's this over here? Doesn't seem like much phases you. And so one of the questions I'm sure the viewers are going to want me to ask you is, what is your mantra or mindset or philosophy on how you go about things? And how is it that you maintain such a calm level?
I think the key is perseverance. I don't mind, and I've failed multiple times, and recognize that you could fail and fail multiple times over. And we call them battle scars. And anyone tells me that it's easy, I did it, and it was an overnight success. I don't actually believe them. I believe that you really need to work very hard, keep on going. You fall down, you get up. You fall down, you get up. Eventually, you're going to succeed. And I think that's really been the key, recognizing that it doesn't always work out, but you keep on pushing forward towards the end goal. And so that's really been the approach that I've taken. And that brings a certain level of calm. You're not expecting anything to happen. When it's supposed to happen, it will happen. Just keep on pushing through. Believe in what you're trying to accomplish. And as the people around you also believe in it, you see that it pushes you forward as well. So there's been many times where you feel that you're going to give up. It's too hard, and then all of a sudden people come around you and see your vision, and they see where you're going, and they actually give you that extra push.
It's very interesting. I think tremendous advice, because I know myself, even as a surgeon in the office, I have this image of what I want, of this perfection at the end, but we're dealing with reality, like you said, in life. Different things happen, and you have to adjust and continue to your goal to get it to come to a good result.
Absolutely.
Which is very, very true. We have this tremendous machine behind us, but I wanted to ask you, what is it that you saw in global healthcare or in our nation's healthcare that you felt needed to be rectified?
Well, I would say global healthcare. I think that what we're dealing with is a global issue. And so first, how did I get into healthcare? And then how did I get to develop this machine behind me? Mm-hmm. And so I consider myself a transplant to healthcare. I always said I came into healthcare. I didn't start in healthcare, but I've been in it now for about 25 years. And I didn't know what I didn't know. And what I mean by that was when I first came into healthcare, my transition was at Walmart. I was actually the one who went to Walmart with the concept of opening up clinics within their stores, create access points for people, one for their workers, mm-hmm. 400 to 500 workers, as well as for the people that live in those communities. And initially it was said, we don't do healthcare, we sell things. And I said, well, I think you should get into healthcare, and worked with some very innovative people within the company, within Walmart itself, and convinced some of the top shareholders to support that. And then we went ahead and said, well, let's try it. As we started to open up locations, we realized that they have thousands of stores, right? Thousands of locations, and they're really, in the U.S., the major player, right, in retail.
Huge chain.
Huge chain, and globally they're a huge chain. But in the U.S., if you could actually have a medical access point inside of a Walmart store, you're really covering a large portion of the United States. And what we recognized was about 2/3 of those locations actually can't support a clinic. They can't actually support having a clinic physically on site. The amount of patients you would need to see on a daily basis was about 25 patients per day. And most of those locations, or at least 2/3 of locations, didn't see 25 patients a day. Some saw 50 and 100 patients a day, but some saw 15, 18, 20. And so there was a internal discussion to say, what do we do? Do we actually continue to run those locations that are losing money because it's giving access to care to a lot of people? Or do we close it down because we're a for-profit company? And so in the end, the decision is, well, close it down, we're a for-profit company. But as we were going through that, I said, can't we change the cost to deliver care? Why does it have to be 25 patients per day? And the answer was, well, that's what it is. Well, why can't we change it? And well, how do you actually change that? You have the cost of a doctor, and you have the cost of a nurse, and you have all the other administrative costs. And so I started to look at how do you create flexibility, take a rigid healthcare system, and how do you actually create a flexible healthcare system, right? And so that became one of the bases of this unit that you see behind us, or this company overall called Medpod. There was a second conversation, and it was in 2007 where I was invited by the Health Ministry of Dubai. And essentially they were building Healthcare City at the time, amazing project that was taking place. I got a chance to sit down with the health minister and some of the other people that were building out Dubai, and saw these amazing plans. And at the end of 4 days, and we were talking about traditional healthcare, meaning the delivery of care similar to Walmart, right? Using an extender, driving down the cost of care, opening up access points, maybe putting them in pharmacies, maybe putting them in other big box retail operations, malls, things like that. And at the end of 4 days, they had actually a visiting health minister that they said, there's a minister that would find this conversation intriguing. We would love if you would be willing to stay. I said, I'm willing to stay. I'm flying tomorrow morning, happy to stay. And this visiting minister came in and said, keep it down to 45 minutes. I don't have a lot of time, but I'm intrigued by this Western medicine thing that you're talking about. And I went on to talk about, again, what he called Western medicine, which was what we call today convenient care, retail-based healthcare with extenders driving down the cost of care. And at the end of about 40 minutes, he said, I would love to do this Western medicine thing that you've spoken about. I will pay you $4 per year per patient. And I said, that's impossible. I can't possibly deliver care for $4 per year per patient. He said, you answered too quickly. I will commit 1 billion patients to this project. And that was the Health Ministry of India. And I said, again, my answer stands. I still cannot deliver care for 1 billion people for $4 billion. I would be stealing your money if I actually said yes to it. And he said, think about it. And I said, I did. I already thought about it. If I could actually hear and see everything that a doctor could hear and see in an exam, understand how they diagnose and treat, I could actually use machine learning, natural language processing, and computing power to solve the problem. At which point I could deliver care for $4 per patient, $3, $2, or $1 wouldn't make a difference, using computing power to deliver that care. So his answer was, when you figure it out, come back to me. And that was the Health Minister of India. Now there's more than 1 billion people there, right? So, but that really was what actually got us moving, right, in the direction of Medpod. It was, how do you actually drive down the cost of care? How do you deliver care for really any amount of money? And how do you take the information, right, that's in the minds of some brilliant doctors and many brilliant doctors around the world, and actually digitize that, right? And at the other side of it, take the patient and digitize that patient. That's what I call the patient twin, the digital twin of the patient. I call the doctor the digital clone. When you take those pieces together, you today they will call it AI, right? You actually apply computing power to solve the problem, and that's where you start to drive down the cost of care and increase the capability of delivering high quality care to anywhere in the world and to anyone in the world.
That's the birth of Medpod.
That was the beginning of Medpod. Yes.
Very interesting. And this is the machine behind us here.
This is one of them. This
Okay.
this happens to be a portable unit, a small unit that folds down into a mobile case, and we'll give a quick demo towards the end.
Sure.
To show
This
how
this
that
can
works.
go this can go anywhere basically.
Last week it was in Kia, Greece, on top of a mountain that was very remote, right? And we were able to call in a doctor that basically takes care of a very high level professional within our government, to be able to see me in Kia, Greece.
Amazing. And so it happens, and it just obviously it's the internet, and I know a lot of times in my own practice with my digital, there are problems with the connection. So how does this overcome that, or?
And so it's optimized to work on any type of network, certainly on 4G, 5G.
Mm-hmm.
It's actually now today was on Starlink in Malaysia. And so it's working, on for cancer patients in Malaysia today, right, on Starlink. So it could work on any connectivity, as long as you can have internet connectivity. Mm-hmm. It doesn't have to be a very high bandwidth. It could actually be pretty low. We've had real instances where you would be surprised, but in the Hamptons in New York,
Yes.
which has some of literally the worst cell service in the country, you would say in the world, maybe. And we've been, places where you couldn't get cell phone calls through, we were actually able to have medical calls come through on this.
With the Medpod
Point 0.20 megabit per second.
Interesting. And so, is this a unit that a physicians group would get, or a company, or how would this work? Is it what level does it work at?
And literally every level. And so if you look at it from a care delivery perspective,
Yeah.
You could go from anywhere from level 1 through level 5, and what that essentially means is anywhere from urgent care, primary care or urgent care, right, where you're taking care of a patient, basic needs, getting into home hospitalization, right, on the other side of it. So if we needed to home hospitalize a patient, put them on a ventilator, which we've had instances where that's happened,
Mm-hmm.
we would be able to do that as well, right? This would become the brain center of a home hospital program. And everything in between, right? So you could do skilled nursing with it. You could do remote patient monitoring with it. Of course, you could do episodic care delivery. You could do specialty care, primary care. You could do specialty care. Ultimately, we'll be doing dental. If we start working together closely, I think we could come out with dental within a few months.
Absolutely. And so, it's interesting when I look at this, it makes me think of a show that I used to love when I was younger, Star Trek.
Yep.
And Bones, when he had Jim on that couch like a Medpod, I guess.
Yeah.
And he was, screening him or whatever. So so we get the viewers a little chance to see tell us a little bit about this, what each of these little portions do.
Well, I'm going to go back before I tell you that, because you mentioned Star Trek, and that was one of the things that drove us in this. The original unit before it was this, what's called a mobile dock,
Yes.
a mobile unit.
Yes.
There was actually a pod. The name of the company is called Medpod, and it was a physical pod that was built of little components, right? Components that come together, little modules that come together to create a medical facility. The original one was 120 square feet. And a beautiful design. It actually looked like something that would come right out of Star Trek. And as the engineers finished up their work and they finished the assembly of it, I pressed the button and the thing opened up, right? The door, it was like hydraulic open of the door. And I said to everyone, it's broken. And they said, what do you mean? It's working perfectly. I said, no, it's actually broken. I said, what do you mean? There's no sound. I said, exactly. There's no sound. Where's the swoosh? The swoosh from Star Trek. And so if you actually call in today, when a doctor calls in, it actually does the woo from Star Trek.
Oh, it does the same thing.
It does. So they said, I'm sorry, we couldn't give you the swoosh, but we gave you the other sound. So
Okay.
so that it was one of the driving forces in the back of our minds as to how do we do that? How do we deliver care, right? The way that they were thinking about
Yeah,
delivering
it's very interesting how a lot of our shows that originally were futuristic and
Okay.
how now we have them as reality, and how the imagination, and it's very interesting, as you were talking to me at the beginning of the show, is the amount of imagination that you have to possess, to put these facets together that other people saying no, no, no,
Right.
because they're stuck within their like boxes or whatever.
Yeah, no, I was saying earlier before we started the show that when I first came into healthcare, I was told you can't do that. It's not possible. This is not. It's not done. And what we were talking about essentially was how do you actually bring siloed healthcare data sets together to be able to look at meaningful information for a patient. If you could actually bring all these siloed data sets, so let's say you've gone to 5 or 6 doctors over the course of your lifetime. That data is, assuming it's digitized, right? Many of them are not. Some of them are still paper, but most of them today have gone digital. They're sitting in different formats, right? In different files, maybe different electronic health record systems. And so in 2005, I gave a speech at Walmart about how do we actually bring together these siloed data sets. And I was told, no, you can't do that. That's impossible. And I said, why not? And they said, no, it can't be done. I said, well, I don't know that it can't be done. I'm telling you that it can be done. And so I laid out what became the basis for the not-for-profit called DASIA. DASIA is what they modeled Health Information Exchange Act on, which was written into law in 2009 by President Obama.
And what, just so for the viewers, what does DASIA mean?
No, so that was the organization, but it was how do you actually take different siloed medical data sets, so different doctors' records,
Right.
and how do you actually bring them together?
So you can utilize them for more efficiency.
So for efficiency, but also seeing across multiple different records to see maybe there's something in one record about your health that's not in another doctor's record. So you have a holistic view, right, of a patient, and the data is out there. So actually, how do you bring it together? So what I proposed was something very simple. At least I thought it was simple because I came from retail, and so I proposed that we actually create a lingua franca. We essentially take the different data sets, right, from different places, and map it like they did for EDI, electronic data interchange, which was multiple systems at the time. It was originally done. JCPenney was the one who did it originally.
Yes.
And they took all these different disparate systems and they just mapped it. They said, this is the language you're going to all speak towards. And so I said, well, why can't we do the same things? No, it's impossible. Well, that today, that is Health Information Exchange Act, right? That was written into law. That is the law today, and that's how we're bringing all that data finally together. If you go fast forward in healthcare, it's something called FHIR, F-H-I-R. So today's standard protocol, FHIR, was based on a lot of that work that was done at DASIA.
Amazing. And you know what? You've taken all this imagination you have, and you were telling me you're actually building a facility in the Harlem area. Is that right?
Yes, we're based at 145th Street and Malcolm X Boulevard. And it's really our first test facility. We've sold many of these units, right? So today there's many Medpod units that are out in the field. We break down units into what we call inbound patient applications and outbound patient applications. Inbound means people are physically coming to us, wherever that means, wherever we are. It could be traditional, it could be a normal clinic or a hospital or something like that, but it could also be non-traditional. It could be in a school, it could be in a community center, in a place of worship, or it could also be in a prison. Right. And so patients are physically coming in and they're stable in a location. Outbound patient applications is where we're actually physically going out to the patient, where we're physically going into their homes or we're going to other locations to deliver care. And so that type of application really opens up healthcare delivery, and it enables us to change where healthcare could be consumed by that patient. And as you start to think about it, patients that are, as an example, frail elderly, they're stuck at home, or sick and shut in, which every community has sick and shut in. They haven't come out even since COVID. People that haven't seen their doctor haven't seen anyone, right, since COVID. So we could physically push into their homes and have the doctor that they normally went to come up on the screen, right? So it's not some random doctor coming up; it's their doctor. How do you actually bring their doctor?
Exactly.
And then start delivering care.
Then he can do all the testing through the Medpod, rather than having it weighed and having all these other logistics that usually interfere.
Correct. So, and I didn't answer your original question, but what does this thing do, right? So this particular unit again, is one of the mobile units. It's one of the outbound patient applications. It's the size of a travel carry-on case. I traveled with it around the world.
It's tiny. The suitcase is very small.
It's the size of the international travel case, so you could fit it in the overhead of every airplane, even the smallest of airplanes. And I've taken it, like I said, it's been to some of the highest places in the world. Chile, the telescope in Chile. It's been to some of the lowest places in the world. It's been to the Dead Sea, the lowest place in the world. And everywhere in between. It's been to Brazil, and it's been, last week it was in Greece, and it's been to Italy, it's been to the Senate in Rome, and so on. So this is traveled, my personal unit's traveled.
I made a joke to you. I said R2D2 is going to be very jealous of Medpod.
Well, we call this M2D2. So this is actually, that's cool. But if you think about what this does, just on a very basic level, this does all your vitals. And I want to say this is not something new that we've created. We've actually worked with some of the best-in-class companies that are up on all the wall boards in the medical facilities. So Welch Allen, as an example, Hill-Rom Baxter, which is today one company, is considered one of the best in the diagnostic space. Midmark is one of the best in the space as well. Massimo, again, one of the best in the space. And so we work very closely with these companies. On the laboratory side, we work also very closely with Abbott and with others like Hariba and so on. And so we take what's considered best in class, we help shrink it down in certain cases. So work with those companies to say, how do you take something that was large and up on a wall board and shrink it down and put it into a small case? And so we engineer the case. This is obviously a patented unit. And this could do, again, all the vitals that you would normally do at your doctor's office, you could do anywhere. You could do scoping. The scopes weren't available, so we actually helped create the scope. And so the scope could be that whatever the doctor would normally see when he would look in your ear, we could also see remotely. So he could be on the remote side, or she could be on the remote side. She could look in your ear and get a full.
Now, let me just ask you a question, because probably the viewers are going to have this question. So the machine will be run by a nurse externally, or?
Yeah, so we call it a care facilitator. Okay. It's actually a low-level technician. Primarily a low-level technician, and I'm answering that very carefully in that it doesn't have to be a low-level technician, but it could be someone almost like an EMT or a paramedic or an MA, usually with phlebotomy skills, so they could draw blood, and they would operate this unit. But we also have doctors that are the care facilitators, and what I mean by that is that I'm not going to mention the names, but this is on some of the largest yachts in the world, some of the richest people in the world as well. They're doctors. They have full-time staff, full-time doctors, and their doctors are literally the care facilitators for them, because they're bringing in specialists. So their primary care doctor, when there's a need, may say, well, let's bring in the cardiologist or the pulmonologist or whatever it may be. And so that care facilitator is the one who's running it. Mm-hmm. Usually, again, it's a low-level tech. It's relatively inexpensive. It's also a pathway towards new healthcare workers. And so we've actually been working on how do you create new healthcare workers and deal with the healthcare shortage issue, within certainly the U.S., but it's a global issue as well. And the other piece of what Medpod does, just to jump ahead, is that I make a very controversial statement, which I believe wholeheartedly. We don't actually have a physician shortage. We have a distribution problem. Right. And that's a global. Everyone would say we have a shortage of doctors in the world. And it's correct by way of the old system. By way of this system, a flexible system, it is no longer correct. We have enough doctors, we have enough workers, right? We just have to get them to where they need to be. So it's a distribution issue.
Makes total sense. So you know what? We almost need a little more time for another show, but we're down to the end. So I want to just ask you a question before we end off here, because we have about a minute left in the show. Quite interesting, because it's going to really give access to healthcare for people who haven't had it. I can see a lot of applications dentally too, like we were mentioning it. What final comment would you like to leave, not just the lay viewers, but also any doctors or engineers or really entrepreneurs or companies that are out there watching? What message would you like to give them?
I think from the standpoint of perseverance, right? What I said earlier. I think, whatever you're working on, whatever you're doing, obviously push, keep on pushing, right? If you get knocked down 100 times, get up that 101st time and you'll succeed, especially if it's something of value, right, to the world. And certainly if your passion is healthcare, you're really doing good for the world, right? You could really change the world, even if it's just becoming a nurse, right, or becoming a doctor, or becoming a care facilitator, to be able to help people that really need help and they're in a vulnerable position, and use technology if you can, right, to bridge the gap. I think that I'm a very big believer in technology. Big believer that it really is the equalizer, and essentially it really enables care to be delivered anywhere in the world, and that's not just for healthcare. It could be for any industry. Technology really could be that great equalizer.
Well, it makes total sense. I want to thank you for being on the show. I also want to thank you, now that I've spoken more to you in the show, for your imagination, your positive imagination, your perseverance that this actually is a reality now, and that I know, because of what we've spoken about, that this will also evolve, and God knows one day in some book in history where your son, maybe David, takes this over, and maybe his grandson, well, that goes back to jewelry, or you're dealing with the Globetrotters, maybe basketball, so like Abe Saperstein, and but it's been a pleasure to have you on the show. And for those of you watching, let's always keep an open mind. Keep to your goals, like Jack Tawil said. Don't give up. Make it all the way. It's kind of like George Foreman. There's never too late. You can always make it. And for a Time for Truth show, have a very good night. We'll see you on the next episode.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet